Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Sharafsaleh, providing you with information on aging-related topics. Learn more at geriacademy.com and follow me on social media. Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Sharafsaleh. My guest today is Dr. Hannah Stewart, whom I used to work with. She was one of our residents, and now she's a geriatric fellow. And we are going to talk about depression and aging. So hello Dr. Stewart.
I'm good.
How are you?
Glad to be here and talk about such an important topic.
So why don't you tell the listeners where you are and what you're doing now?
I'm now at Vanderbilt University Medical Center. I'm doing a geriatric fellowship, and I plan on staying here for at least a little while and doing inpatient geriatric medicine. So definitely miss the mountains, but happy to be here.
For today's topic, we're going to talk about depression and why it's such an important topic.
It's associated with all kinds of things, including impaired functioning, increased risk of suicide, and increased risk of death with other conditions like stroke and heart attack. Lots of older adults suffer from depression, about 10%, and up to 1 in 3 older adults can experience depression in the hospital. So very big part of the older adult population and definitely needs to be addressed.
And, many of our loved ones live in nursing facilities. So it's important to note that 12 to 20% of nursing home patients are suffering from depression, especially right now with the COVID pandemic. We have seen more isolation, more depression, more anxiety.
Yeah, absolutely. I definitely think that that's been a huge factor with COVID.
Sometimes older adults may have symptoms of depression that are unusual or different from the normal signs and symptoms of depression that we think about. Sometimes they may actually experience pain or other symptoms. But can you define what depression is?
Yeah, so doctors use a specific criteria to diagnose what we call major depressive disorder. Several of those symptoms include, obviously, depressed mood, decreased interest in activities or things that they used to enjoy, trouble sleeping, or the opposite of staying awake all night, not having any energy, changes in weight, whether it's gaining weight or losing weight, loss of appetite, frequent crying is also a one that's noted a lot.
How do these symptoms impact an individual?
I think that it makes it almost unbearable to deal with everyday life, which is extremely sad. I think that people just really lose interest in making connections or having those connections with the people that they care about. And that oftentimes people with untreated depression can actually just be completely miserable doing anything.
And I think it's important to note additionally that about 40% of older adults may just have some minor symptoms of depression. It's important to address those as well. Major depression is more noticeable than minor depression, but minor depression can also cause dysfunction and can also interfere with your daily life and quality of life.
So anyone and everyone can become depressed, which is why screening everyone is important. For older adults specifically, risk factors include being a female, social isolation, which is apparent with COVID, being widowed or divorced, lower socioeconomic status, having multiple medical conditions, chronic pain, as we mentioned earlier, sleep issues, disability, cognitive issues like dementia, and one very important one is family history of depression.
Would you say that older adults are at higher risk or just about the same risk of developing depression as younger adults?
Older adults have more medical problems, and a lot of times that I think makes them at higher risk. I'm not sure the exact statistics, but I think that considering as we age, we do have more health problems, that you become pretty high risk to have depression.
I completely agree with you. Generally, older adults are Medicare recipients. When they go in, usually have a Medicare wellness visit. Sometimes providers or healthcare systems are not performing Medicare wellness visits routinely, it's very important for older adults to remind their provider, can I have my Medicare wellness visit? Because within that visit, a depression screen is included. So how do doctors diagnose depression?
So there are several different tools that I feel like change all the time, but one of a very short screening tool that most doctors use is actually just 2 questions. So during the past month, have you been bothered by feeling down, depressed, or hopeless? And then the second one is, during the past month, have you been bothered by little interest or pleasure in doing things? If those are very concerning for depression or a depressed mood, then your doctor will probably perform further testing to see what's going on.
And especially for older adults, because it's so complex, the diagnosis and the treatment of depression, because it's not just about genetics and becoming depressed or trauma and becoming depressed. There are so many other aspects, like we mentioned, disease burden. I think that it's really important to also consider the multimorbidity, those diseases that we have in terms of addressing and treating the depression. And so one of the things that geriatricians do is we specifically ask, how is your heart failure impacting your life? How is your COPD impacting your life? Maybe we can improve the quality of your life by giving you more oxygen, giving you more energy, and that is one way that we address treating depression. So going into treatment of depression, what are some ways that we tend to
Yeah,
treat
so there are
depression?
several ways, and I think you made a great point. You had a prior blog post talking about, am I taking too much medicine? And I think that also that relates to depression as well. The pill burden on older adults can be so significant that that can also cause symptoms of depression, because it's exhausting taking 13 medications in the morning and 13 in the evening. So one of the first things that we do for treatment of depression is actually therapy. It's called cognitive behavioral therapy, which just helps patients to change negative thinking. It improves mood, self-care, communication, and functioning. Many older adults, though, the issue is really don't have access or take advantage.
There's also a stigma, right, with getting therapy for depression, even though we know in the medical community that depression is a disease, just like diabetes, just like high blood pressure, just like COPD. There are chemical balances that play into that depression diagnosis. We might not have some of the feel good hormones that we need, and that can cause us to get depressed. And so, treatment also can be medical. What are some of the treatment modalities that we use, some of the medications that we use in
Yeah,
older
so one of the
patients?
big types of medicines that we use in the treatment of depression are called SSRIs. They are, you really want to think about starting a medication prior to really diving into trying to do therapy first, because medications obviously do come with side effects. And so it's really a decision that you need to make and talk extensively with your doctor about. But those medications are very, very helpful in many patients. Side effects, though, include nausea, dizziness, sexual dysfunction is one that affects many people, weight loss or weight gain. So really talking with your doctor about this. The other issue is that most of these medications take at least 6 weeks or longer to actually steadily be effective.
I think it's important that healthcare providers really help their patients understand that don't lose hope. It may take 6 weeks or longer for this medication to be effective. And also, don't lose hope, because if this medication does not work, there are many more medications. I also think that healthcare providers need to make sure that their patients understand that if one medication does not work in one class, to let you know that another medication in another class might work, and also educating our patients about the safety of some medications. So some SSRIs, like you were discussing, are safer than others for older patients. Some of the SSRIs that we take are not as safe. They can actually interact with heart medications. If you have a heart condition, it can cause some serious problems. And so making sure that your healthcare provider is educating you about those things is really important, and considering your medical conditions when deciding to prescribe a medication. And some of the other medications that we use actually can help with chronic pain. And so there's a combination where you are addressing the depression, you're also addressing the pain. And it's always important to speak with your healthcare provider to decide which medication is best for you. And I'll keep going on this topic because I think it's really important. If you are starting to take a depression medication, it's important that other specialists know that you're taking these medicines because of the interactions that these medications can have.
Yeah.
Right?
And I think, I think more and more the stigma associated with talking with your doctor has become less and less. And I think us as physicians and providers continuing to normalize this as a conversation we have over and over again with our patients. So it becomes more normal in talking about it. And one of my favorite things that I think is awesome that anybody and everybody can do is actually exercising. That is a huge thing in the treatment of depression. And older adults, still, it's recommended 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise a week. And obviously, you need to talk with your doctor before starting any program.
I think that even if some older adults have limitations in their lower extremities, you can still exercise your upper extremities. And getting involved with physical therapy, occupational therapy, when you do have some physical limitations, may be a good way to start an exercise program. And your doctor can definitely refer you for programs like this. Now to a topic that's a little bit more sensitive. Talk about suicide in older adults.
Older adults actually account for nearly 24% of completed suicides, which is astronomical number. And depression is a huge risk factor in that. Nearly 1 in 4 depressed older adults commit suicide, which I think is just a crazy number. I was actually shocked when I first read that.
And therefore, it's really important to make sure that family members are aware when they're noticing that their loved one may have some symptoms of depression, right? Like depressed mood, the decreased interest, trouble sleeping, loss of energy, isolating themselves, not wanting to participate with social events, not calling, loss of appetite, all of those things a family member, a loved one can detect. And that might be the difference between that loved one committing suicide or not committing suicide. So it's very important for family and loved ones to be aware when their loved one is not acting like the way they normally do.
As providers, we only see patients a small snippet of the time. So the family is just extremely important in situations like this.
One of the other things I wanted to talk about is when you have an older adult come in with a loved one with concern for depression, sometimes their symptoms are not depression. And this could be because of dementia. So dementia can sometimes mask itself as depression. We usually see symptoms of what we call apathy. So that loved one may be staring at the wall, minimally responsive to their loved one. They may not engage in a conversation. Their loved one may say, they no longer want to help me clean the house, or they're no longer participating in the things that we used to do. For healthcare providers, it's really important to screen for dementia, not just depression, because dementia could also be the diagnosis. And one of the things that I think geriatricians are particularly good at is diagnosing dementia. It is like the thing that we do.
Yeah.
We are dementia docs. And so when we see patients for depression symptoms or for dementia symptoms, we're always questioning, is it depression? Is it dementia? Is it dementia? Is it depression? And we are moving through those weeds and kind of trying to specifically isolate, what the problem might be, which I think will help the patient ultimately.
And it goes the other way as well. Some patients will come in and family members will actually be concerned about their loved one's memory, saying they're forgetting all of these things. And you will do an exam on their memory and they won't do great. But once you dig a little bit further, you find out that they're actually severely depressed. And oftentimes we'll see, if you treat that depression, they actually score better on that memory test, which is very impressive.
Absolutely. And some of the other disease processes that could cause a person to be depressed could be like endocrine, right? Low thyroid states, low sodium because of heart failure medications, low potassium because of other medications or other disease processes. And so when you notice a patient with symptoms of depression, it's not just important to take that person to the provider to evaluate for depression, but it may be important to take your loved one to a provider, or for you to go see your provider to ensure you don't have any actual medical problems that need to be evaluated and treated. So, what else do you want our listeners to know about depression? We talked a little bit about why it's important to think about depression and aging. We identified depression. We talked about who is at risk for getting depression and what are some of the other causes of depressed mood that may not be depression. And we also talked about common treatments of depression.
I think it's very important for everyone any age to have a physician that they trust. It's somebody that they can go to, that they have built that rapport with, that they feel comfortable with, that they can talk about these hard topics. There's also the National Suicide Prevention Lifeline that's available 24 hours a day. Absolutely take down that number, have it, because you never know when you might need it.
Over the next few weeks, we're probably going to be bringing depression into our topics. But for our listeners, there is a blog on the Geri Academy website. What we just discussed is written down, and it is a short read, but it has those bullet points. So if you can't remember what you just heard, you can check out the Geri Academy website. Thank you so much, Dr. Stewart, for helping me today and helping my listeners understand a little bit more about depression.
Thank you so much for having me.
Have a great day.
Bye.
All right. Bye. The number for the National Suicide Prevention Lifeline is 1-800-273-8255. This number can be reached 24 hours a day. Thank you for listening to this episode of the Geri Academy podcast. Learn more at geriacademy.com or follow me on social media for information on future episodes.